Welcome to Healing Horizons. I'm Chris Daniels, your host, and today we're exploring building resilience, aftercare strategies for veterans post-Ibogaine therapy in Mexico. Ibogaine can catalyze a profound reset, but what you do afterward determines whether insight becomes lasting healing. We'll map the integration timeline, safety checklists, evidence-based therapies, peer and family supports, and practical routines for sleep, nutrition, and purpose. We'll also cover cross-border continuity, telehealth, crisis planning, and access options. Whether you're a veteran, spouse, or provider, this episode offers a clear, actionable roadmap so you can return home steady, connected, and oriented toward a renewed mission. Today, the first 72 hours are about stabilization and gentle integration. Prioritize rest, hydration, light meals, and quiet. Keep stimulation low. Minimal news, social media, and heavy conversations. Journal impressions, dreams, and standout insights without forcing interpretation. Short, slow walks and diaphragmatic breathing help your physiology recalibrate. Avoid major decisions. If traveling home, build in a decompression day or two before flights. Share a concise status update with your designated support person. Clinics should provide discharge summaries, medication guidance, and emergency contacts. Monitor for dizziness, palpitations, or unusual mood swings, and report promptly. This phase sets the tone for safe recovery. Weeks 1 through 4 focus on rhythm and containment. Schedule standing therapy, peer support, and medical check-ins. Set a simple daily framework. Wake time, morning grounding, nourishing meals, gentle movement, protected integration hour, and consistent bedtime. Limit alcohol entirely and reduce caffeine, especially afternoons. Expect emotional variability, relief, tenderness, or irritability. Practice urge surfing when cravings or intrusive memories arise. Establish boundaries around people, places, and media that dysregulate you. Begin practical repairs, finances, paperwork, routine health appointments, and home organization. Keep goals bite-sized and written. Share weekly updates with your team, including sleep, mood, cravings, wins, and needs. Openly. Months 1 to 3 consolidate gains and expand capacity. Increase therapy depth, add a skills group, and gradually reintroduce complexity at work, home, and socially. Use 30, 60, and 90-day milestones to review progress and adjust plans. Months 3 to 12 prioritize maintenance and meaning, service, creativity, and relationships that reinforce values. Track 4 simple indicators weekly: sleep quality, mood steadiness, craving intensity, and connection frequency. If 2 trend downward for 2 weeks, tighten supports. Schedule booster integration sessions at 3, 6, and 12 months. Celebrate small wins. Recovery is iterative. Momentum grows through steady, honest recalibration. Together, cross-border continuity matters. Before leaving Mexico, request a discharge summary, ECG results, medication guidance, and integration recommendations. Ask the clinic to securely share records with your stateside primary care and therapist. Plan travel with buffer time. 1 to 2 decompression days, aisle seating, hydration, and light schedules on arrival. Use secure telehealth for early therapy sessions and clinic check-ins while you settle. Schedule a primary care visit within 1 to 2 weeks. If cost is a concern, ask about sliding scale, VA community care referrals, and nonprofit veteran programs that fund therapy or coaching. Continuity prevents gaps that invite relapse. Safety first. Ibogaine can prolong QT intervals, so a post-treatment ECG is wise, especially with heart history, electrolyte issues, or palpitations. Review all medications and supplements with a clinician. Avoid combinations that further prolong QT or lower potassium and magnesium. Clarify timing before restarting antidepressants, sleep aids, stimulants, or pain meds. Ask about any lingering ataxia, blood pressure changes, or mood instability. If chest pain, fainting, or sustained racing heart occurs, Seek emergency care and inform providers about recent Ibogaine. Routine labs, hydration, and balanced electrolytes support recovery. Safety checklists aren't fear-based. They create confidence so deeper healing can proceed. Build your team before you travel and confirm after you return. Aim for a veteran-informed therapist skilled in trauma and substance use, a primary care clinician comfortable coordinating medical follow-up, a peer mentor or sponsor who understands military culture, a family ally willing to learn boundaries and support plans, and, if the clinic offers it, an integration coach. Share a one-page plan with roles, contact information, and preferred check-in cadence. Clarify confidentiality and crisis procedures. Meet weekly at first, then taper as stability grows. Teams beat talent. Coordinated, proactive support catches problems early and multiplies the impact of your effort. Pair Ibogaine insights with targeted therapies. For trauma, EMDR and cognitive processing therapy reduce reactivity and update stuck beliefs. Acceptance and commitment. Therapy clarifies values and builds willingness. Internal family systems helps negotiate parts that hold pain or protection. Somatic experiencing, trauma-informed yoga, and breath-led movement restore regulation through the body. Neurofeedback can stabilize attention, sleep, and arousal. For identity transitions, narrative therapy and vocational counseling align purpose with action. Choose one primary modality and one body-based practice, then add as needed. The goal isn't more appointments, it's precise, phased interventions that leverage your widened learning window with compassion daily. Chronic pain and traumatic brain injury deserve special planning. Use multimodal, non-opioid strategies, scheduled acetaminophen or NSAIDs when appropriate, topical analgesics, heat or cold, TENS, gentle mobility, and graded exposure. Learn pacing. Alternate effort with recovery before symptoms spike. For TBI, protect sleep, reduce screen glare, use blue light filters, and insert brain breaks every hour. Limit high-intensity workouts early. Favor slow strength, balance, and breath. Consider vestibular or vision therapy if dizziness or headaches persist. Coordinate with a TBI-savvy clinician and share treatment notes. Pain and TBI often amplify stress. Regulation skills and patience are essential medicine for recovery. Relapse prevention works best when written. Map personal triggers across people, places, sensations, and emotions. Identify high-risk situations and pre-plan exits. Create a 24/7 rescue plan. 3 people you can call, 2 grounding skills, 1 safe place, and a statement of commitment. Include transportation options, meeting lists, and telehealth links. Practice craving tools. Urge surfing, 5-minute delay, hydration, protein, brisk walk, and calling your mentor. Remove substances and paraphernalia from home. Set financial friction by limiting cash and enabling accountability. Measure success by actions taken, not feelings. Cravings pass. Your plan keeps values ahead of impulses, especially under stress. Regulation is trainable. Start with simple breath work twice daily. Box breathing 4 by 4 by 4 by 4, or 6-second exhale breathing. Add a 5-minute body scan, noticing sensations without judgment. Use heart rate variability tools or paced breathing apps to reinforce practice. Brief cold or warm exposure can reset arousal. Keep sessions short and safe. Spend time in nature, ideally walking without headphones. Use guided meditations for sleep and emotion labeling. Practice when calm, so the skills are available when stressed. Track perceived calm before and after to build confidence. Small, consistent repetitions reshape your nervous system. Daily structure anchors recovery. Keep consistent wake and sleep times, with screens off an hour before bed. Morning routine. Light exposure, hydration, protein, and 5 minutes of breathing or reflection. Move your body gently every day. Aim for strength or cardio 3 to 4 times weekly as tolerated. Eat stabilizing meals, protein, fiber, colorful plants, and healthy fats. Maintain steady hydration and set caffeine cutoffs by early afternoon. Avoid alcohol entirely for at least 90 days. Schedule a protected integration hour for journaling, therapy homework, or reflection. Mark 30, 60, and 90-day milestones to assess progress and recalibrate as needed. Healing accelerates in community. Join veteran-specific groups, vet centers, or local coalitions that honor your experience. Explore Smart Recovery, AA, or NA, and choose what fits. Evidence shows connection, not ideology, predicts benefit. Establish a post-treatment battle buddy. Daily check-ins for the first month, then taper. Include your family early. Offer a plain language explanation of Ibogaine, likely mood shifts, and your boundaries around substances, sleep, and media. Invite a couples or family session to practice communication and repair. Create shared rituals, device-free dinners, walks, gratitude rounds. Connection protects sobriety, moderates stress, and reorients the nervous system toward safety every single day. Rebuild mission with intention. Clarify values, strengths, and constraints, then shape work or school around them. Consider flexible schedules and phased returns. Use GI Bill and vocational resources. Ask campus, veteran offices, or community partners for navigation help. Practice digital and environmental hygiene. Curate your feeds, silence alerts, and limit doom scrolling. Keep living spaces calm. Reduce clutter, add light, and quiet zones. Delay high-intensity training, nightlife, and chaotic travel until stability deepens. Engage chaplaincy or spiritual care and mentor within veteran communities to satisfy service impulse without overwhelm. Purpose plus pacing creates sustainable momentum and restores pride through contribution meaningfully. Let's close with safety, ethics, and a recap. Build a written crisis plan with early warning signs, preferred hospitals, and contacts. Veterans. Crisis line. Dial 988, then press 1 or text 838-255. If in immediate danger, call emergency services or go to the nearest ER. Culturally, honor Iboga's traditional roots and insist on informed consent, transparency, and realistic expectations in clinics. Today we covered timelines, safety, continuity, teams, therapies, pain and TBI care, relapse tools, regulation, routines, community, and purpose. Healing horizons exist to translate experiences into lasting change. Educational only, not medical advice. Consult licensed professionals. I'm Chris Daniels. Be safe.